Question 6, Honourable Member for Council, Mrs Lord-Brennan.
Thank you, Mr President. I would like to ask the Minister for Health and Social Care in what ways the Western Wellbeing Partnership is the blueprint for the provision of integrated health and social care since the pilot project commenced in April 2018.
And the Minister for Health and Social Care to reply, Mr Ashford.
Thank you, Mr President. The Integrated Care Pilot Project in the West commenced in April 2018. The goal of the first year of the project was to research and construct an integrated care strategy for the West. This would be based on the feedback of the local population, as well as the existing clinical evidence and experiences of other rural and remote populations from across the world who have also implemented similar integrated care systems. The project team developed a model of integrated care that ensures that service users referred into the service have a single point of access for all community-delivered services, enhanced communication between professionals involved in a service user's care. This includes service users only telling their story once and shared record keeping, improved coordination between professionals providing care in the home environment, which includes shared care and treatment planning, and improved planning around home visits to avoid multiple services visiting on the same day. The second year of the pilot was about turning the strategy into an operational model and implementing it to meet the aims of the project, namely improving the health of people and the local population, improving people's experience of receiving support and care, improving the cost effectiveness of service delivery, and improve the well-being and satisfaction of staff. During 2019-20, several milestones have been achieved, not least turning plans into reality, launching the Western Wellbeing Partnership, opening the Western Wellbeing Centre in Peel on the 24th of February, and commencing the core business of the Western Wellbeing Partnership, namely regular multidisciplinary team meetings attended by partnership stakeholders, which includes both statutory and third sector services. The Integrated Care Project team has also commenced the development of the Wellbeing Partnership model in the south of the island. Although the principles of the integrated model remain the same as the West, namely single point of access and improved communications and coordination between practitioners, the Southern Wellbeing Partnership will be tailored to meet the needs of the southern population. Consultation is ongoing to gain feedback from the residents of the south of the island, as well as statutory and third sector partners, which will influence the implementation plan for integrated care in the south. So far, over 150 residents have attended public engagement sessions across the south, and 350 have responded to a service user survey, with responses still coming in each day. The project team aims to have the Southern Wellbeing Partnership model rolled out by the 31st of March 2021, after which the team will move to the north of the island and begin the process.
Supplementary, Mrs Lord-Brennan.
Thank you, Mr President, and I'm glad in particular to hear the Minister talk about improving the health of people across the local community. When asked, communities in the West don't seem to know what the Western Wellbeing Partnership is or the Western Wellbeing Centre, even some who work in healthcare. What does the Minister say in response to that? Minister to reply.
Thank you, Mr President. I say in response to that, I'm quite surprised because the partnership has been very, very active in the West. It's putting together the district nursing teams, the community adult therapy teams, the community support services, the re-enablement services, social work, hospice, Isle of Man, live at home schemes, and the PLGPs have been very involved as well. One of the things I would say, though, Mr President, is perhaps one of the changes people have found is the fact that they don't have to go to several teams anymore. So they're actually finding that the system, certainly the survey we had of the 247 referrals that have been made so far, the feedback that has come back is people are finding that rather than having to tell their story to about 3 or 4 different teams, they tell their story once and they are being automatically referred across the different teams. So while they may not know which teams are involved, that's because it's more seamless than it was before, where they were having to go from pillar to post to different teams.
Supplementary, Mr Speaker.
Thank you. Those with long memories may recall there was a similar project, certainly in the south of the island, I can't speak for the rest of the island, tried in 2010 under the banner of multi-agency teams. I suppose what reassurance I would seek from the ministers before we go through this again in the south, what lessons were learnt from that experience, as well as from Peel, as to why it didn't come together that time. And I believe that one of the significant areas was about co-location and was about data sharing and making sure that that has been properly done. What other lessons have been learnt from that earlier project that means we won't go through the same pain of abandoning it this time?
Minister to reply.
An excellent question from Mr Speaker, Mr President. I've looked at the 2010 scheme, and one of the big issues, and it's something I've raised in this Honourable Court before, is we were asking people to do it within the day-to-day of their existing jobs. We weren't giving them the resources behind the scenes to be able to pull everything together, and that's one of the things that's fundamentally different. Mr Speaker is quite correct. There came up data sharing issues as well in relation to the 2010. We have been in contact with the Information Commissioner's Office, and we've been working with them around what we can do data sharing, and we've got reassurance around that. So we have been taking a much more collaborative approach with this, but the main point of the 2010, certainly from my personal point of view when I look at it and the lessons to be learned, it was the fact it was not resourced properly to get off the ground in the first place.
Honourable Member for Douglas Central, Douglas East, Mr Robert Shaw.
Thank you, Mr President. As somebody who's followed this whole process of these regional partnerships for a long time in various forms, as alluded to by Mr Speaker, I recall very well the engagement at that time between the Public Accounts Committee and the then leadership in the Department of Health, where we, the Public Accounts Committee, expressed real concern about the lack of an integrated IT system. And the response that we got was that it would take years and years and years to bring it in, and that in the interim period it would be an expensive process. Where are we now?
Minister to reply.
Thank you, Mr President, and can I thank the Honourable Member for Douglas East for that question. He knows how digitally minded I am. We are looking to bring the IT infrastructure together. Again, that is being resourced, and it is work that's ongoing. It's not a simple process because I think, as the Honourable Member will know from all his time on public accounts, there is a multitude of different systems out there, but the key point is it's not just reliant on IT, it's also the fact that we can share information, and the multidisciplinary teams meet face to face. So they actually discuss the cases face to face with all of the teams present, and what that actually does is it allows them to decide the route for the person there and then, rather than people having to be passed from pillar to post. But the IT side of it, we are looking to advance to have a single system, or at least a single front end for the various systems, so that people have one record that they can go to.
Honourable Member for Ramsey, Mr Hooper.
Thank you very much, Mr President. In his answer so far, the Minister has set out quite a lot of figures, a lot of milestones, a lot of outcomes that he's talked about. Is he intending at some point to bring a report back to this Honourable Court to actually inform us on the detail of what's been going on? For example, I've had concerns raised with me of a low number of patient interactions as a result of the Western Wellbeing Partnership, and the Minister mentioned in one of his answers 247 referrals. So I'm assuming that's since February 19, when the partnership was up and running. That seems like a very, very low number of patient interactions to me in a year and a half's worth of work. So if the Minister could please update us on when he intends to bring a full report back to this Honourable Court.
Minister to reply.
Thank you, Mr President. I think one of the things I need to point out to the Honourable Member, though, is they all mentioned the 247. Let's not forget, previously, people would have been referred to the services individually. So when referrals have been reported on in the past, that would potentially have been something like 1,000 referrals, because you'd have the same person being referred to 4 different services. So we do need to bear that in mind. But yes, I fully agree with the Honourable Member. I think it's important. We will be giving an update report to this Honourable Court before we go for the rollout in the South, so that we can actually show what we've actually achieved in the West, and obviously we will also give an update to this Honourable Court about how we will be looking to do the rollout in the South as well.
Supplementary question, Mr Thomas.
Thank you, Mr President. 3 or 4 years ago, the integrated care record was a very important part, and that's been hinted at. Can the Minister outline the timetable for the integrated care record, the delivery of it, and who's responsible for that integrated care record programme? Secondly, can the Minister confirm that multidisciplinary teams, multi-agency teams are not new? When we arrived in the island in 2000, they existed. In fact, Manx style, you had to go to lots of them because each silo department wanted its own Manx integrated multidisciplinary panel.
Reply, sir.
Thank you, Mr. President. Can I thank the Honourable Member for Douglas Central, because I think at the last part he's answered his own question about why previous multidisciplinary teams haven't worked. Because when you have to go to several multidisciplinary teams, that to me immediately suggests there's something fundamentally wrong and the system isn't working. In relation to the integrated care record, work is still on that. GTS, as the Honourable Member will know from his time in the Cabinet Office, has been working on building a front end so that all the multitude of systems out there can be pulled together. That work is ongoing. I don't have a set time scale at the moment, but it is an essential part, and the project for that rests with the integrated care team.
Honourable Member for Council, Mrs Lord-Brennan.
Thank you, Mr. President. I'd be interested to know what about younger people and families and their health needs. A lot of the example services are perhaps about the older population. But perhaps just as importantly, how will the Minister find out if there are any areas of concerns, and how is impact and effectiveness assessed? How do we know? How do we review if we're getting the service right? For example, if funding or resource is going to the right areas, and that health promotion focuses on the whole person, the balance is right, and it's not just layers and layers of meetings and management getting in the way, so that we can have the focus on what needs to be maintained. Thank you.
Minister to reply.
Thank you, Mr. President. The biggest thing, just taking the last point first, is around feedback from the users, because that's what's absolutely critical in this. There's no point in designing a system if the feedback from the users isn't good. I've got some of the feedback in front of me, not just from actual users, but also from people who are involved in the system, such as the third sector, that are heavily involved. So, for instance, there's been a handwritten note received, who's received support from the partnership, saying the excellent service from the Western Wellbeing Partnership, being able to pull together the social work team referral coordinator. I felt comfortable going through the service, and it sped things up at what was a very difficult time for me. There was also another user who sent a quick note to say thank you to the members of the Western Wellbeing Partnership for the help that they gave to their family. Previously, they would have been going around the houses via different organisations, and it's pulled it all together. I also have one from a CEO in the third sector who's been involved, who, from the third sector point of view, said they just wanted to drop a line to say, really well done. You have been an amazing team, and it has been a privilege working with you over the last few months. You should be very proud. You are definitely the A-team. I believe we have shown everyone how to do it, and the success cannot be argued with. Fantastic. Turning to the Honourable Member's comments about young people, I fully agree. Integrated care isn't about just focusing on those in the older age brackets. It is important that it crosses over all of the age groups, and that is why, like I say, we pull together things like social work and the re-enablement services, the PLGPs as well. I believe that there are, again, I have feedback from people in the younger age group who've used these services that actually feels that it's sped things up for them. So for me, the key measure is the users themselves, because there's no point having a great integrated care system if the service users themselves aren't happy with it. And as for how serious the department takes integrated care, the fact is I actually have two of my department members actually involved in integrated care, Mrs Corlett, who has been leading it, and also Mrs Barber has it as part of her delegation as well.
Taking two more supplementary questions. The first of those, Mr Robert Shaw.
Thank you, Mr. President. I really come to my feet in response to the Minister's answer to Mr Speaker's question about that which went on down in the south. And I find his reply concerning, as somebody who supports the principles of this wholeheartedly, that we're covering or making up for a lack of a good IT integrated system with physical meetings of very expensive professionals. I find that chilling. And then he can't answer the question about how long it will take. So must we assume, do we assume, that as a consequence of that, we're going to roll out elsewhere with the expensive stand-in process of expensive physical meetings in the absence of a proper IT system? How long before he can stand up in this court and tell us how long the system will take, the new system, the integrated IT system will take to be introduced? Thank you, Mr President.
Minister to reply.
Thank you, Mr. President. I hope to do so before the rollout in the south in March, because obviously while we've been doing the Western Wellbeing Partnership, we've been developing what sort of IT system is required. But one of the things that I do apologise if I wasn't clear in this court, in the Honourable Court, Mr. President, I'm not trying to say that multidisciplinary teams are a substitute for the IT system. Multidisciplinary meetings and teams are fundamental to integrated care, because if you don't have that with the actual different areas sat round a table discussing individual cases, you run the risk of developing the silo mentality, particularly as the Honourable Member for Douglas Central, Mr Thomas, referred to, where you end up with several multidisciplinary teams. So that IT system is not a substitute for the multidisciplinary teams. The IT system helps facilitate that.
Supplementary question, Miss August Hanson.
Thank you, Mr. President. I'd just like to ask the Minister, because I think that what my colleague on Council was kind of alluding to was like a level of market research to an extent. I think, we've talked about, and I appreciate actually the Minister has feedback from those that are contacting the DHSC, which is marvellous, and that's fantastic. However, I think that that this is more about measuring outcomes, and particularly when you've got a very capable review body in terms of your political membership on the DHSC, I think it would be very valuable for them to perhaps be able to have something like this in front of them before things move forward and progress and continue to progress, having measurable outcomes. Thank you, Mr. President.
Not quite sure what the question was, but to do with outcomes.
Well, he agreed. Yeah.
Would he agree? Minister.
Thank you, Mr. President. I most certainly would agree, because we do need information. That's why we have been back to the 200-odd referrals individually to find out what their feedback on the service has been. So that how we have done that exercise, I gave some of the feedback. That's not just people who've off their own back contacted the HSC, but the service has actually followed up with them to find out what their experience of that service was. But yes, I'm happy to agree.